Babies who have their aorta and pulmonary artery in the wrong places, the aorta coming off of the right ventricle and delivering blue blood to the body, and the pulmonary artery coming off of the left ventricle and therefore sending red blood to the lungs.
So what are the most common diagnoses and procedures that you face as a pediatric heart surgeon?
Pediatric heart surgery can be broken up into neonatal heart surgery, so surgery that is done on patients that are less than 30 days old, but usually in the first week of life or so, versus operations that are performed in kids who are 6 months and older. I think in the neonatal phase, probably the most common operations that we do are the arterial switch operation. That's an operation that requires immediate stabilization after baby's born and then a complex repair, usually in the first week of life. Other operations that we do routinely in the neonate are a Norwood procedure for patients who are born with one pumping ventricle instead of two. We do shunt procedures to provide a source of durable pulmonary blood flow for babies who have, for whatever reason, not a good outflow tract to the lung. Arterial flow, double outlet right ventricle with pulmonary stenosis, DTGA or transposition with the VSD and pulmonary stenosis. There's a series of potential issues where you have not enough blood flow to the lungs to support oxygenation of the body. A shunt procedure, basically sewing a PCP pipe from usually the innominate artery or from the aorta, but some source of red blood to the branch pulmonary arteries, and having that be essentially the source of pulmonary blood flow, which means that you're asking the heart to pump both to the body and to the lungs at the same time, with usually not necessarily one pumping chamber, but is an inefficient ask of the heart. And so it's a temporary thing. The PC pipe is usually 3.5 millimeters in diameter, so it's smaller than a big pen.
Wow.
And is responsible for carrying the entire workload to the lungs. So those are procedures that we do routinely in the neonate. The common procedures that we do in the 6-month-old are repair of a child with tetralogy of Fallot. That is the most common cyanotic lesion that a child can have. The most common cyanotic lesion that a child can have at birth is DTGA, or transposition of the great arteries. Certainly the most common operation that we do for the 6-month-old is a VSD repair. A child who has a generous hole between the lower chambers and has enough shunting from the left ventricle through the hole out to the pulmonary arteries that they have, relatively speaking, heart failure symptoms or can't grow well. And we go in at 6 months and put a dime-sized patch and sew it in with needle and thread. And the vast majority of those patients never need to have any more heart surgery and live completely healthy lives and have to be reminded as they're older that they had a hole closed on the inside of their heart.